Hey everybody, it's Chris, and today I'm interviewing my friend Dr. Joel Kahn. Joel Kahn is a medical doctor. He's a practicing cardiologist in Detroit, Michigan. He's also a clinical professor of medicine at Wayne State University School of Medicine. He's known as America's Holistic Heart Doc. Dr. Kahn is the author of 5 books, including Your Whole Heart Solution, Dead Execs Don't Get Bonuses. Would love to talk about that. And also this book, The Plant-Based Solution. He's a regular on the Dr. Phil and the Doctors. He's also debated plant-based diets on Joe Rogan Experience. I know that got a lot of traction. We might talk about that. He was featured on Larry King Live in a recent Heart special. And he owns some healthy plant-based restaurants in Detroit and Austin. Green Space Cafe in Ferndale, which I've eaten at. It was amazing. And actually, Joel was there when I was there, and he gave me a copy of this book. This was last year. And then also Green Space and Go in Royal Oak, Michigan. And he also owns a vegan food truck in Austin called ATX Food Company. So he's a pretty busy guy doing some awesome stuff. So hey Joel, how are you?
Thanks, Chris. I'm very excited to connect to your amazing community and message, and very grateful. Thank you.
Thanks, man. Well, it's been a long time coming for sure. I've been an admirer of your work for many years, and I'm just so appreciative of you and your message and your mission and the good work you're doing, and the fact that you care enough about patients to help them change their diet and their lifestyle, which are such powerful predictors of health or disease. Just our choices, right?
Last patient I talked to exactly 7 minutes ago, her lunch every day is salami. So there is still some progress needing to be made. Of course, these are heart patients. So we got a lot of work to do if you aren't aware that salami might not be a good choice for heart disease. Yeah.
Salami is not only not a good choice for heart disease, but it's a terrible choice if you want to prevent cancer, since processed meats are group 1 carcinogens in the same level of evidence as cigarettes.
We can go off on that topic, which is very personal to you, but very emotional to me. I can't understand why I walk in a hospital and see bacon and hot dogs and pepperoni and what other, occasionally corned beef, when the World Health Organization has said you're serving cancer to your nurses, your doctors, your medical students, your patients, and their families, and why they aren't enlightened. I'm actually unaware of any hospital in the United States that has said we're bold enough to follow the World Health Organization declaration of October 2015. Now, there are varying degrees of health in hospitals. The 2 that I attend at, one has a Wendy's and Chick-fil-A in the lobby of the University Hospital. So you can just, create cancer here and go to the 9th floor and treat cancer. The other one wanted to catch up, so it's adding in Wahlburgers, so you can get the triple burger with the government cheese and the bacon on it. I mean, that's a whole topic. But, people like you, and I hope people like me, need to be the message to the public, because it ain't walking in the lobby of a university hospital that's teaching anything helpful or authentic.
Well, Joel, I don't know if you know this bit about my story, but the first meal they served me after cutting a third of my large intestine out for colon cancer was a sloppy Joe. I know that's a personal favorite.
It's good for the oncology department. That's about all.
Yeah, and the cardiology department too, man.
Yeah, right. Give yourself 20 years there, but right.
So I want to talk about your evolution as a physician. I'm going to make a wild assumption. And this wild assumption is that you didn't get much nutritional training in med school.
Well, I'm a rare exception. My story, very succinctly, I grew up in Detroit suburbs. My parents were conservative Jews. We kept kosher. I didn't eat meat and milk. I didn't eat ham. I walked into the University of Michigan, Ann Arbor, 1977, with a cute girlfriend who is my wife of 37 years. And we looked in the dorm and said, it's salad bar time. And we did that for a year or 2, and we both felt so great. We've never eaten animal products since 1977. So when I was in those classes, even if we got 1 hour or one professor mentioned nutrition, it's like my antennas, like My Favorite Martian, my antennas were actually up. And it was not aware that there was actually benefit or therapy to nutrition, but I had chosen a path. I would go to medical school parties and be the guy having carrots and celery when everybody else was having wingdings. So I actually will say I was ready to receive those messages. A friend in cardiology training gave me John Robbins' book, A Diet for a New America. And it's like, I don't even know who the friend was. It was a little angel. But by cardiology training, I was, a junior Dr. Dean Ornish, but I had not heard his name yet because he came to fame in 1990. So a little different path than most. I actually can proudly say every cardiology patient I've ever seen has heard about Dr. Ornish, and a little later on Esselstyn, and a little later on Forks Over Knives, because I've just been in this mode of plant nutrition for a long time. Now, how many were formal lectures? You're absolutely right. Very few. And how many of my partners around the years did I sit with eating cheeseburgers and fried mac and cheese and pepperoni pizzas? The majority of them. It's still, not really infiltrated into the medical system. So a little different story than most doctors would tell you.
Yeah, that's interesting that you discovered it so early on in your life. And and I'm imagining that most of what you learned from your own independent research, looking at the literature in your spare time.
Yeah, absolutely. I just, I actually started my cardiology career. I went around the country, but came back to Ann Arbor and had my first job July 1, 1990. Well, Dr. Ornish's first really eye-grabbing paper was July 21, 1990. So I joke, I had 3 weeks where the only tool I had to reverse heart disease was balloon angioplasty, which I had been trained in. But after 3 weeks, I had 2 tools, and I have just continued to teach those 2 tools, and now pretty much exclusively teach, heart disease prevention and reversal with plant nutrition, as well as other disease process prevention and reversal.
So talk about the Ornish study. What did you discover when that was published? Why was that so important?
Yeah. So I'll even go back a few more decades because I think it's really cool. And, when these things weren't completely accidental. Some people have seen Dr. Esselstyn use a slide, and a few others use it, that during World War II, and often the example is the country of Norway, if you ask the question, what happened to heart disease deaths during World War II in a European country, I would have said, man, stress, disease, I bet you death rate skyrocketed. In fact, there's this famous curve that overall death and heart deaths went down. Some analysis suggests it was very difficult to obtain meat products and dairy products. They were shipped off to Germany to feed the troops. And it was published right after the war. And an internal medicine doctor in Los Angeles, who nobody gives credit to, his name is Lester Morrison, MD, said basically, I'm going to start treating my heart patients in my very large practice at Cedars-Sinai in Los Angeles in 1948 with a diet that mimics Norway. And you could even call it, very unpopularly, the Nazi heart diet, but that would not sell very well in terms of book publishers. And he actually published a study. I took 100 heart patients. I suggested to half of them that they follow a list. What did the list say? No cream, no cheese, no egg yolks, no olives, no avocados, no added oils, no gland meats like liver, emphasize whole grains, fruits, vegetables, a radical idea. And he let the other half eat the way they ate. In 12 years of follow-up, 100% of the heart patients that didn't change their diet died, and 50% of the heart patients that followed that one sheet were alive. Published scientific data. Who learned of that data? Mr. Nathan Pritikin knew of that data. It was actually in the headlines, reasonably available in newspapers of the 1950s. Mr. Pritikin started that. Then, that data was available to a very young, precocious medical student named Dean Ornish, grew up in Dallas, trained at Harvard and Houston. And he took a year off of medical school, took, if I remember, about 13 sick heart patients having symptoms, walking in the mailbox, locked them in a hotel for 4 weeks, fed them plant foods based on Pritikin, based on Lester Morrison. Actually, Dr. Ornish's main advisor was a yogi named Satchidananda from India, a very famous philosopher. Look him up. He wrote amazing books, said the opening prayer at Woodstock. That actually was a major influence on this young medical student, Dr. Dean Ornish, or that time not yet doctor. This small little study showed in 4 weeks, these sick patients were already feeling better, and studies done like treadmill tests were improved. He published the data in 1983. Nobody believed it. This is crazy. It's too small. There's no randomization. And he got into his residency program. He raised some money from various donors, and he repeated the study in a more proper way. Your group keeps eating the way you eat. This group eats the way I developed based on this data and my input. And that was published July 21, 1990. A very cool study because unlike Nathan Pritikin, an engineer, unlike Lester Morrison, an internist, Dr. Ornish had access to the best technology literally in the world. PET scans of the heart, cardiac catheterization done with the best cardiologists, analyzed with the best computers. And so the 1 year results, 1990, and then the 5 year results were published in 1998, were these sick heart patients where their angiograms actually showed reduced blockage by changing their lifestyle based on a plant diet, meditation, social support, cessation of smoking. And the control group got worse and worse, which is a wake-up call. Anybody, even today, seeing a cardiologist is probably going to have their disease worsen with time. And unless you embrace lifestyle, you may have an opportunity to stop it and reverse it. And in the even more profound was that the amount of blood flow to the heart went up 300 to 400% based on this very sophisticated stuff. So yes, I wish Dr. Ornish had 400 patients in his study. A very difficult science to do. He subsequently added many thousands of patients from just clinical perspective. But, to the point that in 2010, Medicare said, if you're a heart patient, you've had a recent heart attack, bypass, stent, heart transplant, we will pay for you to learn how to follow the Ornish program if you can find a center that teaches it. And there's about 50 of them around the United States. The only other program is they will pay for something called Pritikin cardiac training, which is very, very similar. So it's a huge victory for the concept that plant-based nutrition actually has a therapeutic role. It's indeed the only diet combined with lifestyle like fitness and stress reduction that is actually recognized and paid for by the U.S. government and other health insurers now, because since 2010, many others have added it on as a payable benefit to heart patients. Very cool little history there.
Yeah, it's amazing. And it really, life-saving, potentially world-changing kind of a study. And I know, so Dr. Caldwell Esselstyn also did a very similar study over, I guess it followed people over 20 years now, put them on a plant-based diet, very, very low in fat, no oils, saw the same reversal of heart disease where the clogged arteries with almost no blood flow completely opened up, and where there was no evidence they'd ever been diseased, right?
Yeah. Dr. Esselstyn is, such a hero and such a fine human being and such a sincere human being. And so it is interesting that when he began, he's trained as a surgeon and not a heart surgeon. He's a breast and thyroid surgeon, but he shared a locker with a world famous heart surgeon, and they just in conversation. There's a few super bright people. Nathan Pritikin is one of them. Dr. Ornish is one of them. Dr. Esselstyn said, in my free time, I'm going to figure out how to reverse heart disease, even though that's not my main surgical specialty. And he started to ask the cardiologist at the Cleveland Clinic, give me the ones you can't work with, and I'll see if my wife and I can offer him anything, at a time that I'm sure he was aware of Pritikin and maybe Lester Morrison, but Ornish's data hadn't been published yet. So yeah, really brave pioneer to work individually with people and change this paradigm that heart disease is not reversible, is ultimately progressive and fatal. And the kind of patients that have come to Dr. Esselstyn are such sick people. I'll just tell you an anecdote. We have a gentleman in Detroit. His name is Paul Chatlin. He doesn't mind that I use his name. And about 5.5 years ago, he started to have that feeling called angina, playing tennis, 55 years old, had this treadmill test, had the catheterization. You need bypass and valve repair, Mr. Chatlin. Go to the Cleveland Clinic from Detroit. That's 3 hours, good place to go. The night before surgery, somebody mentions to him, there's the white-haired wizard of Cleveland Clinic called Dr. Esselstyn. Would you ever want to talk to him? Well, Paul Chatlin's a strong-willed guy. Left the hospital the night before surgery. Dr. Esselstyn always calls patients, got the religion, the diet, the whole food, plant-based, no oil, no salt, no sugar diet. don't injure your endothelium, treat your body well. His chest pain, his blood pressure, his excess weight, cholesterol, everything reversed. 5.5 years later, he's never had heart surgery. And that's the power of this, and you have to be very careful because, there are some people that still need, just like you had some aspect of conventional therapy. There are heart patients. I'm not radical. I don't believe every hospital should be shut down and turned into a herbal factory, but a lot of them should be. Paul Chatlin was so grateful for this gift that he called me 5 years ago, and we launched this thing called the Plant-Based Nutrition Support Group. So in Detroit, we have a 6,000 member grassroots movement to support people that are adopting this diet for lifestyle, for heart disease, for diabetes prevention, cancer, whatever. And we don't teach a medical program. We just provide great speakers like Chris Beat Cancer that we have to have you come to Detroit again and speak to our group.
That's amazing. I love that so much. I'm also in agreement. There's tremendous value to conventional medicine. Doctors do great work every day. They do save lives, but there is for a lot of chronic diseases, the solutions they offer don't really get to the root cause of the problem. They're just temporary Band-Aids. In some cases, they can extend life, but they don't actually reverse the problem. And nutrition and lifestyle intervention and exercise and these simple things are so powerful in the body. And it's like, so now I have been talking about Esselstyn and Ornish since I first found them, for years. Because this has been a 15-year journey for me, diagnosed in December 2003. And one of the most powerful things I did for myself was a plant-based diet. And so every time I bring this up, I share something about, I've interviewed Dr. Esselstyn. Every time I post a link to a study or post something that you posted something recently on Facebook, I shared it. And there are always these people that come out of the woodwork and, which we call cholesterol deniers. Right? Because there's this sort of other side of the coin, which I don't even know if that's a fair way to describe it, but there is a contingent of people who I believe have meat lovers bias. They just love to eat animals, who have somehow twisted some science around to convince themselves and others that cholesterol is wonderful and it does not link to heart disease, right? And so I'd love to hear when people say this to you, what do you say?
Yeah, very, very strong cherry-picking selective analysis of the science. So, again, trying to be brief, but until the early 1950s, if you said to a cardiologist what causes heart disease, the answer was aging, inevitable process, God's will, something like that. A Harvard professor named Paul Dudley White came up with this concept. There are risk factors that predictably increase risk or lower risk. None of them are 100% predictive, but that's when smoking, that's when cholesterol, which was just starting to be measurable. That's when blood sugar, the famous Framingham study in the early 1960s. Nobody ever said that cholesterol is the only factor, and the word "the" is very strong. Is it a risk factor for coronary artery blockage? Absolutely. Is it the risk factor? That's what the deniers will often argue, that a case example or a piece of selected literature where in that single study, cholesterol didn't relate to the development of coronary artery disease, blood cholesterol. But that's because there are other reasons. I just got off the phone with a woman who has a weird kind of cholesterol called lipoprotein little a, the Bob Harper genetic cholesterol. Well, her standard profile looks good, but she's 48 with advanced heart disease because it has never been identified as the only factor. It's called composite causes in statistics. Cholesterol, blood sugar, blood pressure, genetic factors. I measured 25, 30 different things in patients, all of which can lead to coronary disease. So they're confusionists. Why do they do it? I think you're right. Meat bias, meat lovers bias is part of it. You sell books when you confuse the public, whether there's meat, dairy, egg, cheese lobby and all behind some of it. I think there is. Dr. Michael Greger tells the story in one of his videos that in November 2008, in a meeting of the International Dairy Society, I mean, a true lobbying group, business group of the dairy industry, the observation was made that worldwide dairy sales are falling, and they didn't want to stand for it. They're a $20 billion industry in the United States alone. Who knows worldwide? They were going to find educational conferences, scientists, and others that they could influence, infiltrate, get reviews, get articles, and they were going to back it with money. They published their notes. So none of this is a conspiracy theory. These are things you can read about in Nutrition Action, a magazine in 2014. Just, it's not even that much of a tough investigation. It just isn't something we talk about a lot. And that's after 2008, November, is when you started to see this confusion. One or two papers may be funded by this group. At least one of them in 2010 was clearly funded by the dairy industry, according to the scientific comments on the paper. And this question, saturated fat could not be confirmed to relate to the development of heart disease. Cholesterol may not be a measurable factor in heart disease. It was like a shift to save their industry from, its downturn, and they were very effective when you get butter on the cover of Time magazine, and you get the chief of cardiology at Cleveland Clinic, Steve Nissen, confuse the world when he says, "I'm not a nutritionist," and then he goes off on comments that add to it. But
and was that study directly linked to the Time cover?
The 2010 one, the authors Patty, Siri, Torino, not, but in 2014, a identical follow-up by an author named Chowdhury launched the Time magazine cover, even though the Harvard School of Public Health said this article, within days, they said this was such a flawed article, we would ask the Annals of Internal Medicine to withdraw the study for all the epidemiologic, methodologic flaws. But by then, the cat's out of the bag, the feathers are out of the pillow. It didn't even matter if they did retract it. Time magazine did its job, and the public loves their butter, their cheese, their meat, and their dairy. So it's very confusing. In 2012, I published a paper with other co-authors at Wayne State. There are about 7 or 8, they're called SNPs, single nucleotide polymorphisms, genetic variations. If you're born with these, that means from birth, your LDL cholesterol is a little lower than the average American. You can just stack these up and track them. They're called genomic analysis. If you're lucky enough to have a cholesterol just a little lower than average your whole life, your risk of heart disease drops 90%. The problem is we start to talk about it in your 40s, your 50s, your 60s. Well, you've already had, for many people, 4 decades, 5 decades of arteries that are coated with high cholesterols. It's harder to prove. In 2018, the European Atherosclerosis Society, definitive paper, LDL cholesterol is a cause of atherosclerosis. Very academic, high-level science. And if anybody really wants to watch, but you have to take no-dose before you watch, there's a YouTube called A Century of Cholesterol, 1 hour, by the Nobel Prize-winning MD, Dr. Michael Brown from Dallas, where I did my cardiology training under his leadership. And it goes through 100 years why blood cholesterol is the cause of coronary artery disease, along with other factors. It's the highest level science. It's actually very interesting and I think quite understandable to the public. It was a public lecture actually in Grand Rapids, Michigan in maybe 2015, 2016. A Century of Cholesterol by Michael Brown, MD. Beautiful YouTube. There really shouldn't be any confusion. You've got a blogger with, self-taught nutrition degrees, and you've got a Nobel Prize winning MD whose reputation and scientific integrity has never been questioned. If you have any sense, you know where you're going to put that side of the equation.
Yeah, it makes sense. And even beyond the studies, which we know can be sliced and diced in lots of ways to prove, whatever the author's agenda is, when you take real patients with advanced heart disease and you remove cholesterol from their diet and saturated fat from their diet and see reversal of heart disease, it just it doesn't take very much brain power right, to connect those dots. It's like, and it's not like it's just one guy. I mean, this has been duplicated.
Yeah.
Pritikin did it. Ornish did it. Esselson did it. I know you're doing it.
Yeah, Joel Furman has published data on it. We all wish we had more. Baxter Montgomery in Houston has case reports of it, and I'm sure he sees it more. I mean, it is very important your audience understands when we talk about the number one killer of men and women in America, it's not cancer. Cancer is a serious issue. It's heart disease.
Well, cancer's number one in 22 states now, though.
Yeah, it is, and it's number one in Canada. All cancers combined, it's a very serious problem. But when you talk about atherosclerosis, the only nutritional plan ever shown to, even to stop, let alone actually also shown to reverse it, is only whole food, plant-based. They happen to all be no added oil programs because it goes back to Dr. Morrison and Norway. It's the tradition has been these diets are all without oil. Keto doesn't do it. Paleo doesn't do it. Mediterranean doesn't do it. Sugar Busters doesn't do it. Whole30 doesn't do it. Whatever one you want to stack up, there is no question we, have the scientific basis to say, there shouldn't be conversation. The sad part is I do literally see patients every day, every week, 20 years of heart disease, 15 years of heart disease, Ann Arbor, Michigan, local hospitals, Cleveland. Nobody's ever, I quiz people. Do you know what forks over knives is? It's like a deer looking at headlights. That's what we say in Michigan. Have you ever heard of Dr. Ornish? Dr. Esselstyn, you had bypass and 7 stents, and you don't know who Dr. Esselstyn is. We got a lot to talk about. I mean, that's my favorite patient because I know in about 24 hours I can change your life for the better.
Well, that's amazing too, and it's frustrating to me that it seems like many MDs have this. They're not educated. They're not self-taught. They haven't been formally trained or personally trained in nutritional science. But beyond that is I think a lot of them have this shrug their shoulders attitude that like, oh, it doesn't matter. They're not going to change their diet. What's the point?
Right. Yeah. The nihilism is, those that speak about Dr. Esselstyn's diet, it's too hard. They won't stick with it. Compliance. That is the uniform academic response to it. And it doesn't even come up because they've never tried it. There is no pharmaceutical rep in a short skirt who's talking about sprouts and whole food juicing. I mean, that's how doctors get their information. And I'm being a bit vulgar, but I'm being honest too. If we could ever, shift that medical school residency and office experience, and it's going to take, the insurance companies to wake up and say they're ready. That's why Medicare pays for the Pritikin and the Ornish cardiac rehab, because economic data was presented that was convincing enough to say that patient will not be back in the hospital and you will not pay another $35,000 for an admission. But, insurance companies don't have people coming to doctors' offices to coach them on how best to utilize a patient's insurance for the better. It would be an interesting idea. So you and I talk and we all talk, and the medical students are much more inclined to be open and knowledgeable about this. Thank goodness.
Do you see this infiltrating more med schools now? I mean, do you feel like some of them are kind of getting on board?
There are, you see these examples of cooking classes, at least the idea that food has a role come up. Certainly not all of them are plant-based, but that's growing. And, nutrition classes are very slightly increasing. There's a few wonderful examples, but very few. At my medical school, Wayne State University in Detroit is the largest medical school in the United States. If I get an hour to speak about plant-based nutrition, it has to be a debate. That's the official dictum. I mean, I have to have a PhD usually because there's no MD they can put up against me. And it's not an ugly debate. I mean, I don't want to confuse students. I actually try and come up with some unity. Just stop eating at the fast food restaurants in the lobby of the hospital. That'd be a good start. But, that's how far it's come in my local community. But, a lot of med schools now will have, it's not official, it's not formal, a plant-based nutrition group. And they'll meet at lunch once a month and have a potluck. Yeah, I see that stuff growing because they see it. They see it on the internet. They're aware of this stuff. They just don't get fed it, literally or figuratively in class.
And Colin Campbell at Cornell, they have a nutrition certification. I think it's a PhD program, right?
Well, any level you want. You can just take a course of a number of hours and get certified in plant nutrition. I mean, it's not recognized as a board certification, but it's still a great education, and you can go on and and do that. Yes, more of those, but it should be built in. Lifestyle medicine. That's the buzzword. That's what's infiltrating. That residency programs are teaching lifestyle medicine. So that's going to be the whole thing: the stress, the fitness. Healthy diets, of which hopefully plant-based diets are discussed as a strong option amongst healthy diets. But God knows they're going to bring in keto diets, I'm sure, as is the buzz good or bad?
Oh, it's the buzz for sure. It's the buzz at the moment. There's a small private practice doctor in near where I live that I've passed by. I don't know this physician. I don't even know if it's a man or a woman, but the name of the practice. This is not an advertisement. Don't know who they are, but the name of the practice is Lifestyle MD, right?
Yeah.
So it's like I've been wanting to drop in, just be like, hey, like, what you doing in here?
Yeah. No, I mean, it might be a very good place to get very good, advice. There is something called the American College of Lifestyle Medicine. Dr. Ornish helped found it. Dr. Michael Greger's been president. But it's a bit mixed. It's not totally plant-based. Dr. David Katz at Yale is very active. And it's now a meeting that draws well over 1,000 doctors and medical students. So this is good, because at least if they'll open their mind that something other than a drug and a surgery is possibly a very important preventive or treatment therapy, they've got to ultimately find that there's a whole lot out there about the science of plant healing.
It's exciting to see. I know the lifestyle medicine movement is growing, and there's a lot of plant-based MD. I mean, there's more plant-based MDs now than there ever have been. It really is a very, it's growing pretty quickly. I interviewed Dr. Christy Funk recently. Do you know Christy?
Yeah, the breast surgeon in LA, right?
Yeah, and she converted to 100% plant-based vegan diet just about 2 years ago while she was researching her book, because she went in there. She was a Mediterranean advocate. And as she went into the literature to find studies that would justify her Mediterranean dietary recommendations, she ended up stumbling on studies that proved to her that a plant-based diet really is the best diet for breast cancer prevention and healing. And she became basically a vegan overnight. Yeah. And is just an amazing interview. I'll link to it in the show notes for anybody that wants to watch that. But yeah, it's cool that to find... just to see this happening, right? And it's got to happen quicker and faster. And honestly, you're going to reach more people than the American Medical Association is going to reach. So God bless you. And that's why, every day I'm posting and I'm, on social media, because it's the numbers. I mean, people are looking and searching, and they'll find authentic, as you say, more and more MDs and DOs and whatever, every medical professional embracing this. But then we have the pressure and the noise and the confusion, not just on cholesterol, but on diet in general. I mean, U.S. News and World Report, 3 worst diets to follow in general: keto, Whole30, paleo. I mean, were they all bought off by the broccoli growers? I greatly doubt they were all bought off by the broccoli growers. I saw that. I'm so glad you brought it up. So let's talk about the ketogenic diet for a minute. I'm a pretty staunch advocate against it. Several years ago, back in 2012, 13, there were some preliminary studies that came out that indicated maybe it had this anti-cancer benefit, and so I was really interested, and I was talking about it like, hey, maybe this is an option. This is really fascinating. But as time has progressed, they've done human studies, and they found that it didn't increase survival at all. And we know, I know, most people don't know that cancer cells, yes, they use glucose for fuel, but if you starve them of glucose, they flip some switches and they use fat for fuel. And if you starve them of fat and glucose, they'll flip some switches and use amino acids for fuel. So it's not that simple. And some cancer cells actually prefer fatty acids to glucose. So ketogenic diet makes sense. But I'd love to hear you talk about the ketogenic diet.
Yeah, very again succinctly. I mean, there is a body of medical literature, particularly in children with seizures, and very limited medical literature for certain brain cancers like glioblastoma, but much more that there was an effort to actually try and stop seizures in children that were occurring before there were pharmaceutical agents. We're talking 60, 70 years ago. They tried to actually water fast children. It works, but children aren't going to do very well with water fasting in terms of long term. And then this idea of dropping carbohydrates ultra low, upping fat in the diet to maybe 90% was tested. And it turns out roughly, I'm not a pediatric neurologist, 30 to 40% of kids with very advanced seizure disorders seem to respond to this diet. The medical literature exists, and it is replete with side effects in these children that in the normal course of medical literature is what you do. We treated 13 kids with refractory seizures, but we saw skin disorders, GI disorders, bone disorders. We had cardiac issues. It's with, you wouldn't sign up for this diet, or it would be like the pharmaceutical ad on TV that 60% of the commercial is all the side effects from the pill they're trying to sell you or the intravenous infusion. The medical literature is very honest and very sincere because that's usually the nature of scientific medical literature, at least of 20, 30, 40, 50 years ago, to be honest. Somewhere along the way, this idea that dropping carbohydrates in the diet, we all agree, drop simple carbohydrates. Don't drink Mountain Dew and don't eat Oreo cookies. And white bread probably should be off the list too. We all agree simple carbohydrates, ultra refined, are not healthy. But we're talking dropping all carbohydrates, like the holy chickpea and the holy lentil and the holy, peas and beans. Drop them ultra low, up your fats ultra high, create ketone bodies once you deplete your glycogen in your liver and your muscle, and fuel your body on an alternative fuel, and you'll feel pumped up, and you'll be a Silicon Valley monster, and you'll be a Hollywood monster. You'll get Halle Berry's gorgeous body, and you'll get Hugh Jackman's six-pack. Somehow that has so infiltrated the culture. But there are some responsible scientists that have asked the question, if we have databases of nutrition, and there are always challenging issues of how accurate databases that ask patients questionnaires about their diet, but there are 10 studies out. They encompass more than 1 million people that the questionnaire described their diet as a low-carb diet, usually high in fat or high in fat and protein. 10 of those studies say the long-term consequences increased death rate, DEATH. The largest study is now over 400,000 people. Second largest study is an author called Noto. It's over 200,000 people. It's a Harvard School study. If you've had a heart attack, you can eat a low-carb diet. It's about 4,400 people. Death rate goes up. So maybe the science is flawed, but it's not one study. It's Greece, it's Sweden, it's different aspects of the United States. I think there's one study from Asian populations. There's a consistency, long-term induction of at least dropping carbs, if not inducing ketosis. It should be discussed. It shouldn't be brushed under the carpet. But God knows, try and read any article in Business Insider or Newsweek about the ketogenic diet. You're going to be very hard put to find the conversation that there's an authentic scientific question about the long-term safety of this. I mean, even U.S. News and World Report said if you want to lose weight in a week, that's not a bad approach. That's the Dr. Atkins drop weight to get into your tuxedo for a wedding. I mean, I'm not going to argue about that, but I've got so many friends. I'm 4.5 years keto. I'm 5 years keto. I mean, what is this doing? Nobody's hardly looking at their blood work. Few are looking at their vascular status. I mean, it's hard to monitor for your predisposition for cancer. People don't realize it takes 10 plus years to develop hardening of the arteries. It takes 10 plus years to see cancer come to fruition. You've been doing this for 6, 12, 18 months because your trainer at the gym or the magazine you read said do it, or you saw an MD that was selling it on TV, their books. I'm very concerned. I have no skin in the game. It gets to the bottom line, responsible reporting of medical science. And so I was on the doctor show in LA about 10 days ago debating a pretty well-known Canadian doctor, Jason Fung, who writes about low-carb diets, the obesity code and all. And I pounced on him because I'm very concerned. Here's an MD teaching low-carb keto diets, but not discussing this, what I call the skeleton in the closet. I'm very concerned. I call them low-carb, high-coffin diets. The long-term consequence is a lot of funerals. And I'm very open-minded. Show me that meat reverses heart disease. I'll talk to my patients about it. Show me that a ketogenic diet extends life, prevents cancer, or reverses heart disease. I will put it in my toolbox for patients, but that's not what I see in the scientific literature. I see warning, 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 Dr. Smith, if anybody's old enough to remember that.
Yeah, and I've looked for that same kind of information too. Obviously, I'm not a doctor, but I just want to share what I find with my audience. Right? It's like we can all learn from these studies. They're made public, right? Let's read them and learn things. And there is not a single study, and it sounds like what I believe is true based on what you said. There's not a single study where they've taken advanced heart disease patients and put them on a paleo diet or a low carb diet or a keto diet and reversed their heart disease. Like there's no study where they've ever done that.
That's clearly true. That doesn't exist.
Right.
And then the biggest question mark out there is a startup, you may know the name, called Virta Health, VIRTA. They're the darlings of the low carb movement. They easily raise tens and tens of millions of dollars to charge people about $5,000 a year, I believe, to kind of online coaching, follow a low carb diet for the halting and reversal of type 2 diabetes. And they actually have some interesting data that goes out now to almost 2 years. These are calorie restricted diets. And a lot of us feel, if you have a nut allergy and you don't eat nuts, you're not sick, but you didn't cure your nut allergy. If type 2 diabetes is a disease of carbohydrate intolerance and you never eat a carb, your blood sugar looks better. That's actually maybe a decent thing. But go eat a donut or a bagel or do a 2-hour glucose tolerance test. You're still the physiology of type 2 diabetes insulin resistance. Follow Dr. Neil Barnard with a whole food diabetic reversal diet. Remove these fat droplets called intramyocellular lipid drops. Go do a glucose tolerance test. You're not diabetic anymore. You've reversed insulin resistance. Maybe somebody can do that, for 40 years. I still worry what's happening to their cardiovascular system. So
yeah, I've seen that a lot too. And I think that's a great point because there's a lot of confusion about this. Because yes, absolutely, you can manage diabetes with a low carb diet or a keto diet. You can manage it. But no one is getting healed of it, right? Yes, their blood sugar stays low, right? Because they're not eating a carb. But I know some amazing guys too, which you may be familiar with, the guys at Mastering Diabetes. Yeah, and
I'm on their upcoming summit. I mean, they're the best.
They're awesome, and they both are type 1. They have coached I don't know how many people now, but hundreds, maybe thousands of people through type 1 and type 2 diabetes, eating a plant-based diet that has no restriction on carbohydrates, and help people reverse type 2 diabetes and manage type 1 much more effectively, with no limit on carbs. Eat all the carbs you want, lots of fruit, lots of beans and rice, potatoes, all kinds of good stuff. So that, and then, what the long-term side effects of beans, potatoes and fruit, like compared to tons of animal protein and fat, well, yeah.
The side effect is better sexual performance. All those papayas and guavas and tremulas that they're eating there at Mastering Diabetes.
Mm-hmm. Yeah. So a lot of people are messaging me often when I talk about legumes and whole grains because they have this newly found food fear of lectins and or phytates because of your someone you debated on was it the doctors? But anyway, Dr. Gundry.
Yeah.
So I'd love for you to explain why they should not be afraid of beans or whole grains.
Well, Chris, I know you're a religious guy. I'm religious too, and I think we should pause for a minute to say a prayer for all the people who have died from eating chickpeas. Brothers and sisters, I pray for your soul, the chickpea souls. You've died because you didn't get the message before Dr. Gundry brought it to us from Mount Sinai. Amen. Okay, now that that's out of the way, Dr. Stephen Gundry, cardiac surgeon, trained in Ann Arbor. He's 10 years older than me, so I didn't interact with him because of that decade difference. Went to Loma Linda, had a wonderful career as a cardiac surgeon doing heart transplants. Brilliant guy. But 15 years ago, he went Hollywood in Palm Springs and started taking care of the stars and the wealthy and became an anti-aging guru. And he made a story up. And the story is Big Ed came to him and was overweight and felt horrible. And when Big Ed found that he let legumes and nightshades, kind of the Tom Brady kind of diet, out of his diet. All his inflammation, all his medical illnesses went away. And Big Ed taught Dr. Gundry that plants don't want us to kill them. Plants don't want us to eat them. Plants have these chemicals, the killer lectins. And if you eat 5 raw red kidney beans, you will die. And Dr. Gundry has discovered this path to eternal health. All that is the biggest pile of poop crap in the world, but he is so convincing, and he looks like Father Christmas, and he has these medical degrees that are respected, but he's basically, soiled them with nonsense. So number one, you can eat 5 raw red kidney beans, you'll get an upset stomach, you just won't die. Don't do it. I mean, cook your beans. Nobody would crunch on raw red kidney beans. There are lectins in fruits and vegetables and meats. Lectins are used in medical therapy. They're a carbohydrate binding protein group. There's hundreds of them. If you have advanced cancer, you might get mistletoe therapy. That's a lectin. That does good things for patients with bad problems. But, the universal message of real health and authentic longevity is that legumes are that blue zone common food. If you want to live a long life, and you're bright enough to say, what do people that live a long life eat? Whether it's Japan, Greece, Costa Rica, Italy, Loma Linda, they all eat lots of legumes. Well, they don't seem to be dying of these killer lectins hidden in plants that only Dr. Gundry has discovered the true path, and fortunately sells a $100 a month lectin blocker, so you can still eat your chickpeas and not die. We
Lectin
should declare that Dr. Gundry national holiday because of the breakthrough. It's, the sad thing is, in the back of his book, The Plant Paradox, is an endorsement by Dr. Mehmet Oz, who I actually think is a pretty cool dude, and Tony Robbins, and Hollywood stars. It's pretty hard to slow down his machine right now. And what worries me is coming out with a new book about longevity, and I don't know what kind of hocus pocus he's coming up with there. But I would absolutely flush his science and eat your properly cooked beans, peas, and lentils. Dr. Colin Campbell of the China study, I owe credit to, realized that if you actually read his book, not the China study, but the Plant Paradox, and you go reference by reference, you've just written a book, you want to make a point, you found a medical article, you put it in the back, chapter 1, reference 7. They're wrong. They're wrong dozens and dozens of times. I've never, ever in my life seen a book by a respected doctor get the references, like they're not even the right topic. They're gynecology, and he's talking about cardiology. It's so fraudulent. And I challenged him about that face to face. He goes, "Whoa, Harvard medical student did my references." Well, it's 3 years later, buddy. Why don't you republish the book? Because he can't. There'd be a blank book called The Revised Plant Paradox According to Science. Be a great book to write your grocery list to buy all those chickpeas on.
Yeah.
It's offensive. And is it harming people to spend $100 a month? It's probably harming people to be fearful of eating legumes because his diet is packed full of, he does like leafy greens and berries and nuts, and thank goodness there are healthy foods in his program. But it's a very animal stacked diet if you follow it in that way. And the final thing to say, the book's called Plant Paradox. I publish papers with the results. Well, there are no published papers with the results. That's called a lie in the usual world, but nobody challenges them. He published a paragraph. It's called an abstract. These are preliminary scientific findings. He calls his diet the Pant Paradox. I mean, nobody proofread this thing. It's proof that there's poop in the pants. He couldn't even get the name right. So I just don't have any grace for this otherwise formerly very well-respected cardiac surgeon. I mean, I have to say, I like the guy. He tells stories like no other, but the medical story he's telling is the emperor wears no clothes.
There's a great video, too, that Dr. Greger made called The Plant Paradox is Wrong, where he points out some of the very first reference in the entire book,
is wrong.
Is totally off. Like he literally, what he says the reference means, the study found the exact opposite. It had something to do with eggs lowering cholesterol or something stupid like that.
It would be like a Saturday Night Live skit, sitting in the back room. We're going to write this book, and it's all fraud. Everybody's laughing, and then it's like the producers. It becomes a hit. Yeah, it's scary.
And I think the big takeaway here too, and I'm glad that you said it, because this is the way I've answered folks for every time it comes up, is when you look at the healthiest populations around the world, the longest living people around the world, they actually eat the most legumes. It's the number
Yep.
one food associated with longevity. So if legumes were so bad, then the people who ate the most beans would have the shortest lifespans, but it's the opposite. So again, another one of those really simple clues that requires very little brain power to understand.
I agree completely.
Okay, so can we talk about cancer? I know you have some opinions and thoughts you'd like to share.
Don't get it if you can, and study all your material if you're unfortunate enough to get it. But in my field, I was mentioning to, and just real quickly, there is a emerging subspecialty of cardiology that's called cardio-oncology. Now, I'm not an oncologist and I don't give chemotherapy, but it's the realization, number one, a lot of people diagnosed with cancer have heart disease known or heart disease silent, and the long-term impact of that heart disease may be as meaningful as the cancer itself. There is a statistic that a woman diagnosed with breast cancer is more likely to die of heart disease than cancer of any kind because of the frequency of the two illnesses. So the recognition that optimal diet, measuring cholesterol, blood pressure, blood sugar, I pay careful attention. You went through, I'm sure, more than one CT scan of your chest, of your abdomen. There's often quote free data there about the status of the arteries, the blood vessels. I pay very, very close attention when I see people to look at either the report or better yet the images. Do these CT scans done for cancer diagnosis also identify unknown heart disease? And very often it just hasn't been commented on. Number two, treatment itself has risks to the heart. Some of that stuff's been known for decades. The most common chemo agent for breast cancer and lymphoma, doxorubicin, daunorubicin, they're called anthracyclines. We know that they can irreversibly damage the heart. Very careful with the dosing. We have to monitor and watch for congestive heart failure. Then there's a new group being used for predominantly breast cancer, like Herceptin. They can reversibly weaken the heart. So cardiologists can get involved with monitoring for side effects of chemotherapy. Hopefully, not in a hopeful manner, some of the drugs we use for congestive heart failure, beta blockers and others, may protect the heart during chemotherapy. There are tests in the blood that may indicate early damage to the heart so we can back off on therapy. Again, always better not to need therapy, but we're monitoring it. And then finally, there is now the recognition that there may be long-term consequences of cancer therapy. Specifically, you got treated for breast cancer, lymphoma with doxorubicin. You didn't develop congestive heart failure. But 5 to 10 years later, there are some people showing up that hearts are not functioning well, and it looks like there's long-term consequences. That great lifestyle we've been talking about for an hour, monitoring, maybe some vitamin support like coenzyme Q10 may be very useful. And for women particularly that got breast radiation over the left breast, there is this little organ called the heart under the left breast, and that radiation therapy may cause the arteries to become diseased 5, 10 years later. So there is now survival clinics, cancer survival clinics, no longer really focusing on the cancer aspects, but looking for the late consequences of actually the treatment, like coronary artery disease and congestive heart failure. So Mayo Clinic, University of Michigan, Cleveland Clinic, University of California, San Francisco now have cardio-oncology clinics doing research, monitoring patients. What is glaringly missing, I was on National Library of Medicine today, put in cardio-oncology nutrition, nothing. The idea that maybe if they're at risk for heart disease over the next 5, 10 plus years, a lifestyle program focused on the only preventive nutrition plan, whole food plant-based, might be valuable. But this whole area is relatively new. In the last maybe 5 years, we're talking about cardio-oncology bridges and connections and interactions. But I'm hopeful, the greatest hope would be reducing the rate of cancer through prevention. But we'll be able to help people through their therapy and avoid short and long-term cardiac complications.
What are some of the early warning signs of heart disease? And I'd like you to talk a little bit about the cardiac scan.
Okay, yeah,
calcium.
and I appreciate that. So your arteries, you're born with clean arteries. I'm just going to grab a little model I always have on my desk, nice little clean arteries. But, what we're worried about is very silently, they can become clogged up with this gruel, atherosclerosis. There are studies by age 15, 18, 20, if you ultrasound the neck of a teenager in Louisiana, you'll already see that they no longer are these nice, pristine arteries. And by age 30, 40, 50, they may well be starting people to drop like flies. So how do you know? Because the heart, in the way it's structured, you will get no warning sign until your arteries are very severely clogged. That may be pressure, tightness, squeezing, shortness of breath, and such. So how do you know? There's a few clues. One, there's a very weird one called a diagonal earlobe crease. Just look up Steven Spielberg on a Google search. You'll see he's got this deep crease. A New York physician 50 years ago, Dr. Frank, observed this correlation, published it, forgotten, but now with these CT scans, it's about 70% accurate. Now, not if you're 12 years old, but if you're 48 or 58 years old and you go to the mirror and you see a deep, deep crease that shouldn't be there, or your earlobes look like Steven Spielberg's, you have a 70% chance of having advanced coronary artery blockage. That gave you a clue. There's a theory why there's the connection. But I actually see people all the time that come to my clinic. Why are you here? I have the earlobe crease. I want you to check me out. So I've written about it. I publicize it. 70% accurate is as accurate as a stress test. Premature balding, premature gray is associated with premature heart disease. The big one for guys is erectile dysfunction. 42 years old, starting to have a problem in the bedroom. Go to the doctor. You get a Viagra prescription. That's okay. But the conversation should be, Joe, Bob, Steve, we need to know your cholesterol, your blood sugar, your blood pressure. What are you eating? Are you going to the gym? Are you smoking cigarettes? That may be a sign your blood vessels are clogging and you'll have a heart attack in 3 years. Let's get on top of that now. That's what the urology and the cardiology literature say to do. It's easier to give a blue pill, or unfortunately now you just go to these online services and get the blue pill. And that connection that it may be a warning sign is missed. And then you get to the final tier or level, which is, why do we go for colonoscopy or Cologuard? Why do we go for mammography? But for heart disease, we do nothing at age 40 or 45 or 50 other than some simple blood work. And I urge everybody to get that simple blood work. Find out if your cholesterol is 450 on a genetic basis, or if you're doing the ketogenic diet and your cholesterol is 450 because you're a hyperabsorber of cholesterol.
What? Let me get you to unpack that a little bit more. In terms of blood cholesterol, what do you, I know that there's a sort of common opinion of what normal cholesterol is, and then there's the whole food, plant-based, and lifestyle MD opinion, which is different. What's ideal cholesterol look like to you?
Yeah, I mean, I'm not giving you the plant answer here. I'll actually quote one of the leaders of the paleo movement, is a PhD student of the hunter-gatherer diet, Dr. Lauren Cordain from University in Colorado, a very popular book called The Paleo Diet. He's written in the medical journals, optimal LDL is under 70 and optimal cholesterol is under 150, based on the natural cholesterol of populations removed from processed food, fast food, eating in primitive and jungle situations. So the cholesterol in native Okinawa, 110, 120 total cholesterol, in Sardinia and in Loma Linda. So that seems to be consistent in the science. No blue zone has a cholesterol of 290 as their average cholesterol, and they don't need it for their brain. You do not need a cholesterol 290 to be a 95-year-old surgeon in Loma Linda doing heart surgery, like Dr. Elliot Worsham, who recently passed away at 104.
I thought that was
normal total cholesterol is under 150. You can make all the vitamin D, all the testosterone, all the other sex hormones you need with a cholesterol. Actually, the Nobel Prize winning physician, Dr. Michael Brown, said you can have an LDL of 25 to 30 and a cholesterol of 80 to 90 and make all the vitamin D and sex hormones you need if the rest of your diet and environmental exposure is okay. So,
cholesterol under 150 is ideal. Yeah.
Yeah.
But they've raised the standard and they now say that under 200 is ideal because so many people have high cholesterol. They're saying under 200 is normal.
Exactly. And I recognize there are people with cholesterols over 300 that don't show signs of atherosclerosis because it has always been a factor, not the factor, in coronary disease.
I understand that.
But if you have a sick artery and a sick endothelium, a high LDL cholesterol is directly going to result in plaque. That's almost certain. If you keep your cholesterol very low, it won't happen.
Are there any other clues in blood work?
Yeah, there are, but let's come back to the CT scan at the very end. There are. We talk, you talk, I talk, inflammation. Your dental health, your diet, your sleep, your waistline, your psoriasis. What else might cause vitamin deficiencies, omega-3 deficiency. You're pumping out chemicals into the blood that are the warriors to protect you, but the signals are wrong. The signals are processed food and waistline of 42 inches and gum infections because you don't go to the dentist and all this thing. These warriors are starting to do harm, not protect you. So you should get at least one test called a high sensitivity C-reactive protein. That is correlated, if elevated, with both increased risk of brain disease. It's a marker of inflammation, cancer development, type 2 diabetes development, and certainly heart disease. Many, many studies correlated. Those cholesterol deniers will often say it's not cholesterol, it's inflammation and insulin resistance. But whether you're a cholesterol denier or not, you want to know whether there's inflammation occurring in your blood. I like two more. One's called homocysteine and one's called lipoprotein little a. These are easily available and affordable blood tests. Homocysteine, HOMOCYSTEINE, that indicates if methylation is occurring normally in your body, and if you're adequate vitamin B12 and folate intake from your diet. And lipoprotein little a is this genetic cholesterol. Bob Harper, The Biggest Loser, kind of made it famous, though the science has been there. And like if you've got this family history of early heart attack and stroke, and your doctor tells you, don't worry, your cholesterol is 160, you haven't really dived deep enough. You want to know if you're lipoprotein little a. It's literally lowercase a, and it's $22 to get it checked in any lab. It's just not on a routine lab panel.
So what are the normal levels for those three?
There's two ways to measure it. One is under 30, one is under 75. Last patient I just got done with before jumping on with you was 350, 400. And their arteries age. In fact, that was the example of this woman I just finished chatting with. But the ultimate, there is something equivalent to the mammogram, the thermogram, the colonoscopy of the heart. And that's what you brought up.
Yep.
That in the last 20 years, and let's say the last 10 years, you can go to a local hospital in your community, medium or large. You can have a prescription pad that says heart, artery, calcium scan. You lie on a stretcher, you get pushed in a machine, a CT scan. You hold your breath and you go home. The test takes 20 seconds. No IV, no injection, no needle, no claustrophobia, no exercise. Doesn't matter if your blood pressure is up, down, heart rate. You just hold your breath and it's done. And you get a number. And a number should be 0, meaning that analysis says your heart arteries are not calcified. It's a calcium CT scan. Your arteries are not evidencing silent, unknown hardening of the arteries. That test can come back 100, 500, 1,000, 1,400, 1,800, based on how many pixels and how much calcium. It's a software program. Very quantitative, very reproducible, backed by several thousand studies that indicate 0 is an unbelievably low risk of future heart attack for maybe 5 to 10 years. And 1,800 is a very high risk of running into trouble or some bizarre number like that. The problem is very few medical societies have taken this and said, it's down to $75 in some hospitals $50, some $100. University Hospital in Cleveland announced last week they're giving them away for free for appropriate people. You're 45, your cholesterol's up, you're smoking. Even in November, the American Heart Association has been really slow to the game to put this on the forefront of cardiology. Early detection of silent heart disease, to slap people awake, to eat better, move better, take better care of themselves. But they said in November, in a statement, if your doc's handing you a prescription for Lipitor, because your cholesterol is 230, you might want to get that CAT scan first. And if you're a 0, go to the gym, eat some broccoli, lose some weight, but you don't need to rush to a prescription for a drug, for a disease you apparently don't have. but work on your lifestyle and get it in place. So that's been a breakthrough that's led to a lot of headlines that medical societies are endorsing heart artery calcium scans. Monoradiation equivalent to a mammogram. I'm sensitive to that. I don't do it in 25-year-old patients. But you have this test once, maybe twice in a lifetime, unlike maybe a mammogram where you might have it 5 times in a decade and beyond that. So very, very reasonable trade-off for this, incredibly frequent disease that tragically robs us of a lot of, wonderful people.
So I wanted to clarify, because my audience they're action takers and they're note takers, and they're going to want to know. You talked about the normal levels of lipoprotein little a. Is that what it is?
Right.
What could be considered normal or healthy? Let's just say not normal, but healthy or ideal levels of C-reactive protein and homocysteine. So if they're getting blood work done first and they see all 3 of these are up, then they might think about getting a scan or whatever.
Yeah, all labs and all evaluations of high sensitivity C-reactive protein, the winner is under 1.0. That's the blood level. And homocysteine, the best data is under 8 or under 10. A few labs still say under 15, but eat enough, folate in your green leafy vegetables and B12 in your nutritional yeast or your daily supplement. You can usually get your homocysteine down. Yeah, it jacks up with red meat, so that's another reason. But it's very important for plant eaters to make sure they're getting adequate folate and B12. It should be easy to get folate because we're all eating lots of leafy greens. But I am a big fan of making sure you at least measure your B12 level. When your B12 goes down, your homocysteine level goes up. And there are some studies that we'd see even a greater benefit from a plant-based diet for preventing heart disease if more uniform use of B12, therefore lower homocysteine levels, became the norm, which is why I always talk, don't be a dumb vegan. Take the friggin' B12. Don't risk it. Or at least get your blood work checked on a regular basis.
Well, now I'd like to see what my so you'll be pleased to know my cholesterol has always been under 150. It's a good start. My C-reactive protein last time I had blood work was 0.15.
Excellent.
So, like crazy low, which I was excited about. Homocysteine is in typical blood work, is it not?
You would have to ask
for it.
Is
it special? Okay. Then
every
I don't know
lab,
what it is.
Every lab does it, and it's inexpensive. Or you can just order it on your own at WellnessFX or lifeextension.com if your doctor doesn't want to or isn't familiar.
Yep. So next round, I'm going to order that and the lipoprotein little a, because I want to want to know what it is. Make sure.
You really got to do it like once. Genetic tests don't need to be done over and over.
To clarify, if a person had normal, let's just say their cholesterol was 150, right? Is there still a chance that their lipoprotein little a could be really high?
Yeah.
Okay.
Yes. I got a lot of people like that.
Okay. So it needs to be looked at.
Right.
That's fantastic. Dr. Kahn, thank you so much for your time. So valuable. I appreciate you so much. Everybody, I want to encourage you to get Dr. Kahn's book, The Plant-Based Solution. And once you read that, you'll want to read his other books, I'm sure. He's in Detroit. If you need a cardiologist, he is open for business. And make sure you check out his restaurants if you're in the Detroit area, Green Space Cafe. It's amazing. Thanks. I want to go back just to eat there again because it was so good. And then next time I'm in Austin, I might have to get on the Facebook page for the ATX food company food truck and stock it.
Food is so healing and so wonderful in Austin on Barton Springs Road. But thank you. Yeah, it's a great friends of mine are running the truck, and you'll fall in love with them in about 5 seconds.
That's amazing. Well, thanks again for your time. Everybody, please share this. Please like it. People in your life need to know heart disease is a #1 killer along with cancer. And it doesn't have to be. It's preventable. It's reversible. We have so much power to take control of our health and change our lives. And Dr. Kahn is just an amazing resource and fellow mission team member, advocate, super health hero.
Punch it down, buddy.
Boom.
All right, boom.
Thanks, Dr. Kahn. See ya.
Thank you. God bless.